Deadly Profits: The Dangers of Informal Lead-Acid Battery Recycling. The purpose of this presentation is to provide an interprofessional intervention to address the issue of recycling lead-acid batteries and the adverse health conditions that result from this dangerous practice. Table of contents. This presentation will cover recycling used lead-acid batteries, health conditions acquired as a result of this ineffective disposal, as well as interprofessional approaches, collaborative interventions, and benefits of a multidisciplinary approach. Finally, we'll close out with a summary. The recycling of lead-acid batteries is a practice that has become more prevalent in lower middle-income countries. As cities become more motorized and these regions find profit in recycling of the lead within car batteries. An estimated 85% of lead in use today goes into batteries, mostly for automobiles. And when the batteries run down, 99% of this lead is recycled to make new batteries. Many of the locations where this informal process takes place are economically marginalized, and the lead in these batteries is quite profitable, despite it being poisonous to the environment and the people who reside in these communities. Most of these batteries are broken down in residential areas, with children, pregnant women, and families, making them highly susceptible to lead poisoning, among other illnesses. This issue is of great importance because experts say the pollution from unregulated operations is a lethal threat, with children being the most vulnerable to poisoning. According to UNICHA, a third of the world's children are poisoned by lead. Lead-acid batteries contain highly noxious and toxic chemicals, such as lead and sulfuric acid. Both lead and sulfuric acid can contaminate soil and groundwater. The electrolyte solution in lead-acid batteries contain sulfuric acid, which is highly corrosive and can cause severe chemical burns to the skin, and it can also damage the eyes. The solution is also poisonous if ingested. Lead poisoning is very dangerous, especially to pregnant women and children who are susceptible to injury. And for pregnant women, lead exposure can cause severe brain damage, lifelong cognitive and physical impairment in their unborn children. Furthermore, exposure has been linked to mental and behavioral issues in small children as well. Professional approaches to used lead-acid battery disposal. The social worker's primary focus was on that of the community and community outreach. She suggested that there be community engagement at every turn, providing incentives and buyback programs in easy-to-drop-off locations, as well as conducting surveys. The attorney clearly wanted to determine the source of the injury and enlist experts to drive forth his point that the corporations were responsible for the ineffective disposal of the batteries. He would prosecute the violators, in this case the corporations, and then sue for damages. The mindset behind his approach is that expensive lawsuits make companies change recycling processes and adhere to regulations. The political economist suggested to hold the corporations primarily responsible, and that there would be a social good versus harm tax. And he also suggested that there'd be a rollback in development policies forced on the global south, such as debt forgiveness for pending and outstanding loans. Upon further evaluation of practical interventions, we decided that the best intervention is collaborative in nature, taking into account the disparate situation of lower middle income countries and in placing responsibility on corporations that contribute most to this problem. Therefore, we decided to engage the community in the conversation, thereby empowering them and providing incentives to the community as well, an easy accessible drop-off points for used lead-acid batteries. We also determined that creating informational sessions with the community of the dangers of improper disposal of lead-acid batteries and the health complications that can arise because of it would be beneficial ultimately overall for these communities. Furthermore, we determined that we need to hold corporations and companies accountable. We also determined that this can be best done through litigation, litigating corporations for injuries, disabilities, and deaths resulting from unregulated disposal. Multinational companies should not be allowed to own the resources of the global south. Profits can then be used to boost the local economy. Recycling used lead acid batteries presents numerous issues that benefit greatly from a multidisciplinary approach. By recognizing intersectional issues, we can ensure that issues that go beyond health are addressed because these communities are affected socially, economically, culturally, and even politically. Therefore, the most effective intervention enlists the expertise of more than one discipline. In summary, we've discussed the improper disposal of used lead batteries and the health conditions that result from exposure to the toxic chemicals that arise from this process. We've also reviewed an interprofessional assessment and provided collaborative interventions. Finally, I discussed the benefits of the interprofessional approach to interventions. Overall, this process proved to be quite informative, and I hope it was for you as well. Thank you for watching. Goodbye.